The American College of Radiology,
Focused forward.
together.
Hello, everyone. My name is Sapalu Anidobu. I'm a fourth-year medical student at the University of Illinois and the host of the ACR's Global Talks podcast. I am joined today by Dr. Mesha Martinez, who is a board-certified pediatric radiologist, neuroradiologist, and neurointerventionalist, and a globally recognized expert in pediatric neurointerventional radiology. She's the founder and medical director of Clarity Brain and Spine, where she specializes in spinal disorders, cerebrovascular disorders, and CSF disorders. Misha, thank you so much for joining us on this podcast today. I'm so excited to hear about all your work that you're doing as a radiologist and with global radiology. So I'm going to pass the mic to you to talk a little bit more about yourself and your work.
Awesome. Thank you so much for that wonderful introduction. It's absolutely a pleasure to have you as my host moderator. I am so excited to talk about and share the work that I have now begun doing on a global scale because it has taught me so much. It's given me an experience that I couldn't even have imagined, and it's helping people who are in need of help get the help they need. So I will go ahead and go to my slides if that's okay.
Absolutely.
Awesome. So pediatric neurointerventional radiology. Yes, I am an adult and pediatric neurointerventional radiologist. I'm the only pediatric radiologist trained in the United States in neuroendovascular surgery. And that has given me a unique perspective and has brought me to many tables that I wasn't expecting to be invited to provide my expertise and my insights. And what I've learned along my journey, I did 9 years of training after medical school, and I've been practicing for 8 years now. I have learned that this unique training pathway has opened my eyes to a lot of deep concepts of what is happening with the brain when it comes to adults and especially children. And my passion and my purpose is really to really advance the world of neurointerventional radiology for the pediatric population. And there are children all over the globe. So that has opened up doors where my expertise has been found to be a need for children outside of the United States. So I kind of made this presentation to kind of give a opening to some of the global work that I'm doing, and I'm calling it Peds Neuro IR Global Impact, the Next Frontier. And I'm going to introduce my personal project and baby right now, Clarity Brain and Spine, as well as the organization that I've been working with, WASI for short, the Western African Stroke Initiative, that allowed me to start being able to share the knowledge that I have attained through all the training that I have done to help children in Africa. So why global radiology? Again, I have to talk about my experience. We all, as radiologists, go through the 4 years of college, the 4 years of medical school, the 5 years of residency, including an internship. And after that, I decided to do 3 fellowships for a total of 4 years because I really wanted to understand disease processes. I really wanted to be an expert in my field. And I wanted to offer a insight that no one else could offer. And so with that knowledge comes power, because knowledge is power. But with that, for me, my natural predisposition is to share that knowledge and help others. And so a lot of people talk about, why do you go into medical school? I went into medical school because I truly wanted to help people, classic cliche. But for me, helping people is sharing knowledge and empowering people to understand what's going on, to learn how to make themselves better or do the things that are necessary to be better. And I've been that way from a very young child up until today. And so for me, global radiology, not just having all the resources and all the knowledge for a country that is pretty advanced and doing a good job of educating and providing resources for its people, although there is room in the United States for that. But for countries who don't have access to all the resources that the United States has access to, it is my personal belief that that knowledge should be shared. And especially for pediatrics, which is my passion, my purpose, no child should not be able to have access to a good start, to get in better, to get health. And so global radiology for me is just the next step of my journey and my evolution in my career to take that knowledge, take resources, and giving back to people who don't have knowledge or resources. And so I'm going to tell a story that actually was very and impactful to my career. This is a patient in the United States, and this baby was born to brand new parents. And this is actually a publication that I just did in the Journal of Neurology, where mom and dad, first child, super excited to have this new baby, had been on Facebook talking about how God had blessed them with their very first child. And they were just very much looking forward to being new parents. But of course, 12 hours after mom delivered, baby started suffering seizures and events of apnea or not breathing, and ended up being transferred to our facility where an MRI was done. The MRI is not the focus here. More the story is. But since we are radiologists, we can see that things don't look quite normal in the posterior fossa for this child. The cerebellum is displaced. There's a large flow void-like structure in the posterior fossa. And then when we look at our DWI images here, we can see that there's evidence of cytotoxic edema. Yes, ADC was corresponding to say it was cytotoxic edema. And so this child was diagnosed at the time of the reading with hypoxic ischemic encephalopathy, and prognosis was considered to be poor. This is called a posterior fossa cerebellar hemorrhage. And although it was causing severe obstruction of the fourth ventricle and obstructing the ventricles upstream, they said there's nothing we can do. There's no way we can decompress this. Prognosis is going to be very poor. And the family actually started going on Facebook saying that, even though God gave them this blessing, God was now taking this baby away from them. It was super sad. And there were a lot of supporters on Facebook really reaching out to these parents to support them through this sad prognosis. But a brilliant neurologist called the pediatric NIR service, which was 2 women at the time, and basically said, hey, can you take a look at these images and can you assess this baby and tell me what you think? Because I'm just not so sure that this is the diagnosis. It's not fitting together for me. And I was able to review the imaging and diagnose this as something totally different. What this turned out to be was a persistent transdentorial sinus that had developed into a dural sinus malformation, which is an abnormal development of the veins that can cause significant issues and problems. And for this child was actually given the presentation of the seizures and not breathing, but also had thrown her into DIC, where she was oozing and bleeding and clotting, and no one really understood what was going on. They just kind of thought this was the end. And so with the new diagnosis, it totally changed the treatment plan. And although as a neurointerventionalist, I didn't have to do anything but advise management and make recommendations off of the interpretation of these images, it actually saved the baby's life. And so here is actually a picture that the family gave to me. And actually the citation at the bottom is the case report that we just published 2 days ago. And this little baby is now home. She's the big sister of their second child, and she's doing amazingly better than anyone could have predicted that she would have done. And so, again, if there wasn't the ability for me to just have a conversation and talk to the providers for this baby, then this baby probably would not have ended up home with her parents, because her parents were basically on Facebook saying goodbye. But just a phone call, just a little bit of extra knowledge, actually changed the whole life and outcome of this child in the United States. So why wouldn't that be something that's not being provided for children everywhere, especially now that we have social media, we have the ability to speak and talk virtually. I mean, we're not even being charged to make these phone calls anymore if you have the right Verizon or AT&T plan. Sorry for mentioning names on this talk, but we can now communicate and share knowledge and change children's lives. And so when Dr. Uche, a neurosurgeon trained in neurovascular, reached out to me to let me know that the West Stroke West African Stroke Initiative was going down, I was more than wholeheartedly happy and excited to be a part of what they were trying to do. And basically, what they were saying was in West Africa, there's no neurointerventional radiology services. There's neurosurgeons, there's neurologists, but they're doing things the old fashioned way where they're doing open surgeries. And the goal of WASI, West African Stroke Initiative, is not only to go and provide care for patients who are in the country or in West Africa, in Nigeria or West Africa, but also to provide training for the neurosurgeons who are already there, who have practices, but to teach them how to do minimally invasive, less risky, less expensive procedures that the world of neurointerventional radiology provides. And so they asked me to join them and be a provider for pediatric patients in West Africa and teach the neurosurgeons how to do neurointervention. And so that's what the West African Stroke Initiative was. I had my first opportunity to go this past summer, and I am waiting and excited for the second opportunity to go again. I arrived June 27th and was super exhausted because, mind you, the time change is a thing. And here I am with Dr. Uche, the neurosurgeon, and George, who's a physician in Nigeria who happens to be a liaison and the guy who's keeping everyone on both continents together because he coordinates. He makes sure that images are shared and Zoom meetings are had in order for us to be able to communicate to help the patients in Nigeria. And so I arrived, and the first day we got there after a red eye, and the goal was just to get some sleep so we could be in our right minds in order to be able to see patients and provide them with our expertise. On June 28th, here are more pictures of the team. This is Dr. Uche again. He's in the United States. I'm here, Mesha Martinez, currently in Austin, Texas. We met with the neurosurgeons who are currently practicing there. This guy is a senior who's been practicing for forever. This young lady, who's my favorite, okay, because she is a woman, is working on starting her own practice and has been practicing in Nigeria as a neurosurgeon for a while. Our goals as a neurosurgeon and radiologist was to teach these neurosurgeons on the logistics of neurointervention. And what they did was they put about 6 patients together one was an adult, the rest were all pediatric, that we saw in clinic for the whole day of Saturday. So we got there early, 8 a.m., early because we were severely jet lagged. And 8 a.m. is not that early, but it was for us. And we saw patients in clinic and talked to their families who had traveled from all over Nigeria to Lagos in order to see us. And so here's more of the team that ends up being with us. There were nurses who helped assist us with documentation and seeing the patients. And then there were technologists and other nurses who are in the neuro suite. And from 8 a.m. until probably about 6, 7 p.m., we saw these patients and were able to assess them, perform a physical exam in preparation for their procedures the next day. June 29th and June 30th, we just spent time in the angio suite. We started off at 8 o'clock in the morning. We got out pretty much 8 p.m. I think the first night we got out at 11 a.m. The second night we got out at 8 p.m. and we all had flights to leave at like 5 or 6 a.m. the next morning. So it was pretty intense. I learned a lot about myself because I've been an attending for a while now, so I haven't had to do super, super intensive long hour shifts. But it was back to the years of being a trainee where, hey, time did not matter. Tiredness did not matter. Get the job done and do a good job doing it. And so here we are with actually the nurse, the CNO of the hospital. This was the CEO of the hospital. And this was another neurosurgeon who was also being trained on how to do neurointervention along with the neurosurgeon who's a senior neurosurgeon and happens to be the head and president of neurosurgery for the continent of Africa. And then myself and Uche. And so here we're actually in the angio suite. You'll see me in these pictures in various positions. Sometimes I was being the teacher. Sometimes I was hands-on and doing the procedure myself because there are certain things that can happen in neurointervention very quickly that can cause the patient harm. And those are not times for practicing and learning, but more so for a expert to be doing the procedure. So here we're getting access and I'm teaching the neurosurgeon what we're looking for, how to get access, etc. Again, here I'm actually doing some things hands-on to show the team exactly what needs to be done. And I was very excited to teach from setting up the room to positioning the patient on the table to making a sterile environment to the group based on the rules of neurointervention. To the technologist, this guy was amazing. I mean, hadn't done a lot of neurointerventional procedures because this group is pretty new. And I think there had only been 2 mission trips before me, but he was ready. He'd done a lot of cardiac. He had done some interventional radiology in the body world, but he kept up just like he had been doing neurointerventions for years. I told him I was going to put him in my suitcase and take him home. And he said he'd be more than happy to do so. And then here again, you're seeing us as we're treating, diagnosing, performing angiograms, performing interventions on a monoplane, okay? A single plane machine, where biplane, the standard of care in the United States is to do it on a biplane 2-camera machine. We were doing some complex pediatric neurointerventional procedures on a monoplane. And so day 2, more of the same. And I have this short video to kind of play that actually shows us in action, which I thought was fun. Well, me in action. Although everyone was in action, it was definitely a team effort. I am not only doing the procedure, paying attention to the imaging, interpreting the imaging, but also teaching them exactly what I'm looking at, what we're looking for, what next steps are, what to prepare for, etc., so on and so forth. And I learned a lot, although I brought a lot of expertise to the table. I cannot say that it was an unfair exchange because I learned just as much as I was giving. And this is why global work is so important to me. I learned about the culture. I learned about the state of healthcare in Nigeria. I learned about a little bit of the politics of Nigeria. I learned about the cultural differences on every level. How to talk to patients, what is disrespectful to patients. I could tell you stories for days, even during that one day of clinic, about some of the things that I was doing as an American person that was kind of not the best thing to do if you're a Nigerian person or a Nigerian physician. It was truly eye-opening and amazing. So I look forward to going back again. I continue to be a faculty for the group, and I'm teaching the neurosurgeons there by not just going and showing procedures, but also doing didactic sessions and interactive virtual sessions. And our next session will be on October the 8th, where I'll be talking about vena-galen malformation. I did a pediatric neurointervention talk before. I did an intraarterial chemotherapy for retinoblastoma, how to start a program, since I had that experience. I'm also going to do a little bit about AV shunts, which is my passion in neurointervention, to treat and to understand and the impact that it has in the molecular medicines and genetics all around it. And so the work is not done. And I'm so excited that this is, again, not just a mission trip to go do something and then come home, but we're actually training the people who are there in order to continue to grow and learn and help their people in Nigeria and West Africa. Now, part of this talk is supposed to be about cultural competency, and I kind of talked about it just a little bit. But definitely there were things that I saw that I was kind of like, oh, that's different. And basically what I did when I was there, I'm a curious person. I love people. I think that's why I have the kind of personality and experiences that I do have. I'm very curious about people, what makes them tick, what makes them upset, what makes them feel disrespected, what makes them feel love, which is always my goal. And so I remember talking to Dr. Uche, the neurosurgeon who is currently with his family in the United States, but is giving back and started this nonprofit program about like, what are things I should be saying or not saying? What is considered disrespectful or something that as a physician, I shouldn't ask? And so it was nice to have him there with me to kind of help me navigate those questions and teach me right when I was on the job. But cultural competency for me is important no matter if you're global or you're in the United States, which is a bunch of people from all over the world who are coming and living together. And there's a whole bunch of diversity here. Cultural competency for me has been important because culturally, I'm married to a person from Spain and my children are considered bilingual. And there has been the need for me to understand European or Spanish culture versus African American culture. So cultural competency is something that is important. It should definitely be a part of the education in radiology, but it only helps us be more helpful to those that we are trying to make better health wise. And so the future is bright. I'm looking forward to continuing with WASI. I've also started my own private practice. I'm no longer in academia. I miss you guys, but I just want to make things more accessible to the people who need neurointervention. And I'm trying to be a person who's not just stuck at one facility, but can really help people globally, nationally, to help them get that second opinion, that like the case report that I talked about earlier, that can change the life of a child and thus a family. So I really appreciate the opportunity to talk about my experience, and I look forward to your questions.
Thank you so much for sharing, Misha. That's awesome. That is so cool. I also personally, I'm Nigerian, so I've had the opportunity to do some medical work in Nigeria, and it's so impactful. It really is getting to go somewhere else and just serve a different community and seeing how much the work that you do can reach others. So that was honestly what I was able to receive from your PowerPoint was just wow, in 48 hours, the amount of impact you can have on people
It
you've
was
never
an
met before, never seen, never interacted with.
it was amazing. It was the highlight of my summer, and I was in Spain for a lot of the summer, but I was just like those few days, um, people were amazing. I didn't mention the food, but the food was the bomb.
Absolutely.
And they made sure they took care of us. I mean, we didn't have much time to leave the hospital, but they were so kind. We would have tea breaks and coffee breaks, and they would bring me some rice and meat that was always amazing and well spiced.
Yes.
So it was
One
highlight
thing you can trust
on
is
this.
that you'll be well fed in Nigeria. Absolutely.
Oh my goodness. Yes, absolutely. I cannot get past that part, although we did do impact and help a lot of people, but the food was amazing.
So I guess one thing I'm curious about, you just started, like you said, your own private practice,
Yes.
Clarity, Spine and Brain, after transitioning from academia. You're the founder and medical director of that whole institution.
Yes.
So how did you come to the conclusion, I have time to do things outside of my rigorous work life and I want to invest more outside of this?
You know, it's a personality thing, I think. Um, Being an employee, it's nice, right? Being in academia is super nice. You have a lot of resources. You have a steady income. You have rules. You have schedules to follow. There's a lot of structure and order, which I, as a type A personality, really love and enjoy. But there's another part of me that is truly curious, that is truly innovative, that is an early adapter on the curve that they talk about when it comes to advancements and technology. All of those things have always made me want to learn more. That's why I did so many years of training after medical school, but also want to make things better. And so what I found in my personal experience as a woman of color in the academic space was that I didn't have the opportunity to do probably 90% of what I was capable. And that's my personal experience. And I don't knock academia. And if next year I'm back with an institution, don't judge me. But I just felt like I'm doing 10%, I'm giving my 10%, and not as in effort, passion, but I'm like, there's 90% more than I can offer you. And I remember having conversations where people would say, well, no, 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 that would be too much. No, 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 you can't do that. No, 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 you won't have time. Or no, 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 there's not enough hours in the day. And I'm like, well, these are my days and these are my hours. And if I'm telling you that I'm capable, then let's go. Academia also can be slow, and I'm an impatient person. That's something I'm working on. And it's like, hey, let's move quicker. And so now I just want to see how it is on the business side. I must say so far, and this has been as new as April of this year, there's just a different vibe of collaboration and moving things forward and doing it quickly that I like. And I'm hoping it will continue to be my niche and my place. And again, more importantly, if I was only given 10% or able to offer 10% of what I could offer, I want to give my patients 110%, which sounds cliche, but when you're energetic and more importantly, when it's your passion, there's so much you can give and there's so much you can do. And that's what I'm trying to do through creating my own pathway and allowing referrers and patients and industry. And I don't discriminate. Learn from what I've learned, advance the field of medicine from what I can contribute with my thought process and just advancing the field. I really want to advance the field of pediatric neurointervention and neurointervention adults for adults too, and just make medicine better for everyone.
No,
So yeah, good question.
we definitely need more people to take that kind of initiative. I think that's very, very important.
Thank you.
You speak more specifically towards what actual pediatric cases you saw during your time
Yeah.
there and
Yeah.
kind of what your approaches were to treating them.
Yeah. So, one of the biggest cases that was, again, I didn't include pictures, but if you follow me on LinkedIn or X, I showed an angiogram of a young lady who had developed a POAV fistula. This was an abnormal connection between the posterior cerebral artery directly to a cortical vein of the brain that was then dumping into the deep venous system of the brain. And so she had been healthy and whole, but she started having seizures at the age of 15. And parents were kind of like, we don't know why she's having seizures, what's going on, but the MRI proved to be abnormal and it was a vascular issue. And we were able to actually safely disconnect that arterial connection with the vein with a monoplane. Again, I stress that because usually we say one view and radiology is no view. But Lord have mercy, we had to figure out how to make it work because she was decompensating. She wasn't doing well. She even had episodes of status epilepticus where she ended up having to be admitted to the ICU because her disease was progressing and, some of her veins were actually being damaged from the shunting that were going on and closing and causing her venous hypertension and her symptoms to just worsen.
Wow.
And so we were able to do the case safely, no complications. And, the impact is phenomenal on so many levels when you do pediatrics because they truly say you have more than one patient because you have the patient themselves and then you have their parents and loved ones who are super invested in the outcome of the child. And so she went from the status epilepticus episodes caused her to be really disoriented. She wasn't responding to her name. She wasn't removing the right side of her body. Interestingly enough, on MRI, there was no indications of permanent brain damage, but it was only indicators of waterlogged brain, meaning there was vasogenic edema And for me, when it comes to something like this, that's reversible. So less than 24 hours after the procedure, she started moving her right arm, started moving her right leg. She started responding to when you called her name. She wasn't able to um, speak back, but instead of just ignoring you completely, which I got to see the night before, she was actually in-house. We didn't see her in clinic. We just rounded on her after clinic. Um, we would call her name and she would try to track and follow, which she was not doing before. So even in that short amount of time being there, it was just phenomenal to see the impact of a procedure that for me was challenging because of the monoplane, but straightforward otherwise. Um, and disconnecting this abnormal thing that happened that the family had no control over. This child had no control over. It wasn't because of something that was done or environmentally happened. It was just, I was born this way. My body was maintaining normalcy for a while, and then it needed help. We were able to go and help this child, and I will never forget this for the rest of my life. So that's one example. We saw more children, and just interacting with them and their family was so impactful.
Yeah. That has to be just so rewarding. Like,
You cannot believe it. I mean, I get goosebumps, and even a part of me almost tears up as I'm telling these stories because I remember the faces when I'm talking about it. I remember, the sense of relief, the ability to even say, "Hey, yeah, I know you're scared, but we have a plan. Trust me and be calm and have peace." I mean, that's a great feeling.
mhm.
And then deliver on it. You can't beat it. I love what I do. I
Yeah.
love it. Like everyone knows who knows me. I love what I do. And so yeah, it was phenomenal.
So, what advice do you have for like other people that want to get involved in similar work that you're doing now?
Yeah. So WASI, for instance, is in its infancy. I mean, it's a new organization. They're doing everything they can to raise money because all of the care that's being offered to the patients when it comes to the neurointervention and it comes to the supplies is not being charged. It is, again, a organization, nonprofit organization that is doing so many good things in so many ways because again it's also training the people who are there to continue to be able to practice and be able to they always say the saying, you could teach someone, you can give someone a fish or you could teach them how to fish,
Right.
right? So they're actually teaching them what to look out for, and they're having the courses, and they're doing, I mean, they meet every week on Saturday. I don't make every session, to be honest, but they meet every week on Saturday and they just go over cases and they do education, and then they're trying to increase their frequency of going there. Instead of every 3 months, they would like to go every month. And so you could go to the website, you could sign up to be an educator, you could sign up to do the mission. I think if you really want to be involved globally, if you're in academia or you're in private practice or starting your own practice like myself, you can find organizations that want volunteers. And if you're okay with volunteer time, which my husband says I would probably work for free if he wasn't married to me and I would be homeless just doing the work, you can get involved and you can do the global work. So it's not hard. I think the hardest part for me was when I was in academia was trying to get over there and not have to cover call. And so when I branched out on my own, now that I'm more in control of my schedule, I was finally like, oh, let's go do this. Like, especially because that one young lady that I was talking about was getting worse. And they kind of were like, Dr. Martinez, we really could use your expertise and help right now. And so it's just about making time, having the idea that you want to, and then finding the people who are already putting the infrastructure in place in order so you can do it.
Yeah. I love that. All right. My last question. What can we look forward to from your work in the future? You said that there's a lot more
Yeah.
kind of initiatives and things
Oh
you
my
want to do
gosh.
outside of just
Oh,
Oxy. Maybe 20 years down the line, what
oh
do you
wow.
hope to see for yourself, or kind of like the impact you've hoped to have made in the field of pediatric neurointerventional radio.
Yeah. Yeah, you got it. You got it. Okay, so you just blew my mind because you went 20 years, and most people go 5 or 10. But of course,
Oh,
I
we
can
can do
answer that.
5,
No,
but
no, no, girl, I can do it. Trust
let's
me, I'm
go.
already thinking 20. You know what I'm saying? But people don't use it a lot, so
Yeah.
I like your style. So 20 years from now, I see myself probably nearing retirement, but definitely still being involved. And my idea with starting my own practice is to create a new standard of care and a new model of care. And what I envision for my practice is not only just this private practice servicing the community, but actually being different. I love research. I'm still actively involved. There's a lot of projects on my plate. I'm looking at lymphatics. I'm looking at how that impacts brain health. I'm looking at how it impacts CSF pressure disorders. I want to continue to advance the field of pediatric neurointerventions. I mean, there's not a lot of cases, but there's so much you can learn from a case that actually is applicable to the adult world as well. And so I want to continue doing research. I also want to continue teaching. So my goal is to have this model of care where I have a training program where I'm actually raising soldiers, in a sense, people who are going to be as passionate and loving and caring and knowledgeable as myself, and plant these centers of excellence around the nation and eventually globally, where it's easy to access specialized care, it's cheaper to access specialized care, and you can really feel good about the people that you're seeing because they want to treat you like family. So I want to create a new model of care that is different, but also still you're doing the research, because I feel like without research, you're not learning. Okay. You're not staying up with what's going on and what's changing in our world of medicine, especially with AI. Oh my goodness. Is exponentially growing at a rate that we have never seen before. And without training, you're not giving back. You're not also staying up with the times, because, hey, the stuff that I learned in medical school, the people that I've mentored and wrote, and I am writing papers with in medical school, in residency, they're teaching me things that they weren't teaching me in medical school. So that's how you stay on top of the curve. That's how you stay innovative. That's how you stay best serving your patient. So I expect to see little uh, neuroendovascular centers around the nation in 20 years that offers imaging and cerebrovascular care and elective procedures and complex procedures. And maybe I'll even start my own hospital. Who knows? We'll see.
Fantastic. Can I have a job?
Indeed, girl, I am recruiting actively. Why do you think I'm on this?
Remember, this is being recorded, so I will be
Hey,
back.
we are good. Hey, like I said, I'm creating an army of multicultural, open-minded, curious, innovative people. Patients will just want to be your patient if they have a problem.
Yeah, that's exactly what we need.
I'm on a mission. I'm on a mission.
Right. Thank you so much for coming on this podcast today. Thank you so much for sharing your story, your experience in Nigeria. It was such an amazing story to hear about and learn about. And I personally feel inspired and I hope that down the line, that's something similar I can invest my own time and energy into too. So
you will.
I will. Where can people find you?
So I am. I'm gonna take a pause, because every time I think about my endeavors to do this, I kind of have to think.
Yeah,
I am going to be on Instagram and TikTok. Whoa!
Lovely.
As a millennial, I'm understanding that social media is important. I'm already on LinkedIn and a little bit on Facebook, and on X. But if you are interested in referring or picking a brain or discussing a case, you can reach me at care, CARE, at Clarity Brain and Spine. And clarity, I chose that word because it means clearness, understanding, being seen, being heard. And so claritybrainandspine.com. You could shoot me an email. I would love to hear from you.
Awesome. Thank you so much, Mesha. And thank you, everyone who listened to this podcast. We will have another episode coming up for you all very shortly. Bye, everyone.
Bye.